Hello and welcome to another episode of Anatomy and Physiology 101 with Spear Medical. I'm Eric. So as I've explained before, these 101 sort of anatomy and physiology screencasts are just a brief introduction to a topic, an anatomy and physiology topic, and we encourage you, once you've watched this, to get your head into a good textbook or a more technical description of the processes that we explain on these 101 sessions. It is just aimed for those that are unfamiliar with the topic to get a brief understanding, or for those that are familiar but a little bit out of date or out of practice to refresh and sort of revise their knowledge around the subject area. So we're going to be covering electrical pathways of the heart this time around. So this is where we're looking at the path electricity travels through the heart and causes those atrial and ventricular contractions to occur. So we start off right at the very top with the sinoatrial node, the SA node. Now this is the heart's natural pacemaker, and this sets the tone, if you like. This sets the beat that the heart should hopefully beat to. So we get a discharge of electricity from the sinoatrial node through the atria and around the back of the heart, and eventually all of that electricity then starts to pull back into the atrioventricular node. It's held in the atrioventricular node for a brief moment, and after a pause there's a further discharge of electricity from the atrioventricular node down here, down through the bundle of His. Once we've passed through the bundle of His, this then splits in two, and we have the left and the right bundle branches, and all this then allows ventricular contraction to occur. So once we hit these bundle branches, we get that good strong ventricular contraction. The electricity then fizzles out into the Purkinje fibres, which are the little sort of terminal ends that are branching off from the left and right bundle branches. So in a nutshell, we start off at the sinoatrial node. Electricity is discharged and makes its way to the atrioventricular node, down the bundle of His, into the left and right bundle branches, and then eventually into the Purkinje fibres. Now, why are we talking about this, I might hear you ask. So, for those of you that are familiar with this, I apologise, it's not the best drawn ECG in the world. For those that aren't familiar, you've probably seen one before. It's an ECG or an electrocardiogram, or at least part of one anyway. And actually, what this is measuring, these patterns that you've seen around, it's actually measuring the discharge of electricity in the heart heading towards or away from a capture device, like a little camera, if you like, which is your ECG sort of your ECG lead. So actually, this starts to tell us a little bit of a picture, because we start to relate what goes on this picture here on the ECG to what's going on here with the heart and how electricity is moving around the heart. So this is by no means an ECG lesson. It is a very broad and complicated subject, but if we look at the sinoatrial node, when the SA node fires, it creates this, which is the P wave. It then hits the atrioventricular node. We get that brief pause, which is here, and then we get a big discharge of electricity down through the bundle of His and the left and right bundle branches, causing ventricular contraction. This is it represented on an ECG. We call it the QRS complex. And then as everything recharges, as everything resets, getting ready to fire off again to allow this to occur again, we get repolarization, which is shown as the T wave. So actually, all an ECG is showing us is how good or bad this electrical system is functioning, and allows us to start diagnosing problems and initiating certain treatments to either manage acute or chronic conditions. I hope you found this helpful. Like I said, it has been a brief introduction to the electrical pathways of the heart. If it is new to you, I encourage you to get out there, get your head into the textbooks, or look forward to more technical and advanced videos that we'll produce later on down the line. Thank you very much for listening.